Do you know that all reactive syphilis test results do not actually mean that you are positive for syphilis infection? Let me explain. You see this result on the screen. It is a reactive syphilis test result. However, a healthcare provider who is not experienced in the interpretation of STD results may call this patient to tell the person that he or she has syphilis infection. Meanwhile, it is a false biological positive result. The RPR is reactive just like it will be in anyone who has syphilis infection. But the most important thing here is that the treponema pallidum antibodies is non-reactive and the RPR titer is 1-to-1 ratio. Therefore, this result means that it is either a very early syphilis infection within the past few days or it is a false biological positive result. What we usually do in this case is to call the patient and inquire more about his or her sexual history, especially most recent sexual history. And if there's no recent exposure, we will have the patient repeat the test immediately. And 9 out of 10 times, they usually come back negative or non-reactive. However, if the person have had any recent exposure, we will repeat the test within 2 to 3 weeks for confirmation. And if indeed the person has syphilis infection, then the RPR titer will rise, as well as the treponema pallidum antibodies will become positive. And in this case, the patient will be treated immediately. In this case at hand, this person test was repeated a few days later and it came back non-reactive and negative for syphilis infection, as you can see on the screen. So if you ever go for STD testing and your syphilis test result is like this as you see on the screen, and you have not had any recent exposure or previous exposure, then ask your healthcare provider to repeat the test instead of panicking for a false positive result. Common causes of false positive syphilis test results are autoimmune diseases such as lupus or other infections such as HIV or malaria, recent vaccinations, pregnancy, IV drug use, or older age. If you like this video or have experienced this type of false positive result before, let me know in the comment section. Like it, share it to reach more people, and don't forget to follow me if you're not doing so. Thank you.